I'm Dr. Mercy Hylton. I practiced adult and pediatric emergency medicine in the central Indiana area for close to 20 years. During the pandemic, the general pediatricians were let go with the plan to replace them with nurse practitioners and physician assistants. And when I questioned this, what I was told was that when things are busy, you won't be able to see all of the NPs and PAs patients. You'll just have to sign off on the chart. And I felt that that was an inadequate model of care for me. I was seeing a lot of mismanagement from NPPs. I started digging into Indiana's laws, and what I found is that there was no requirement for a physician to be present in an emergency department. So in 2021, I wrote a resolution for my state medical society asking for legislation to require emergency departments in Indiana to have a physician present. And that passed. Senator Liz Brown at one point had reached out to me asking, why do we need this bill? What is the prevalence of emergency departments without a physician? Because honestly, like nobody had ever heard of that. Is that really happening? So I literally reached out to a large group of emergency physicians on a social media group asking for people to please private message me if you are aware of emergency departments that do not have a physician present 24/7. And I got several hundred responses with names, and I tabulated all of those and I presented those to Senator Brown in terms of this is what's happening. And there were some very prestigious names on that list. People would be shocked. And then in 2023, the Indiana law was able to pass through the legislature.